Hi, I'm Dr. Tony Salamay, and what I'd like to do is I'd like to talk to you about the connection between fibromyalgia and chronic fatigue. So, a lot of times these two different syndromes can get mixed between each other because not everybody who has chronic fatigue has fibromyalgia, but most people who do have fibromyalgia have some sort of fatigue. So, what we're going to do is we're going to talk about the actual connections and why they are so intertwined. Fibromyalgia is a neurological disorder. And what happens is, in fibromyalgia, the brain misfires. And when the brain misfires, what happens, it sends a signal down into the adrenal glands, and that causes a spillover in adrenaline hormones. These are your epinephrine and your norepinephrine. And cortisol. So these hormones, when there's stress or there's fight or flight in the body, regardless of what may have triggered it, it could be a trauma, it could be a toxin, it could be a virus, it could be anything. It could be an emotional stress or psychological issue that has happened and it set this whole pattern up. So what happens is it taxes the adrenal glands, and that's usually why most people have the fatigue along with the chronic pain. Now, with chronic fatigue syndrome, we may not have this problem with this whole chronic pain. So we may have a lot of that adrenaline got released, but for whatever reason, the brain does not perceive the pain, but they're still having fatigue, and they're having widespread fatigue throughout the body, throughout the tissues, because of adrenaline stimulation, and the body just can't produce enough of those hormones anymore. Those hormones that we just mentioned not too long ago, the epinephrine, norepinephrine, and cortisol. So typically, initially, before fatigue sets in, it's normal for us to produce a lot of those hormones. But what happens is, once we produce a lot of it and then the body can't make more of it, that's when we start to see the problems start to occur. That's where we start to see that and we start to experience the fatigue. Or in fibromyalgia, you have the fatigue, and we have the chronic pain, and we have all these things that are all playing a role because of that whole adrenaline stimulation. So the body what it'll do is it'll make more of it, and then eventually it'll start to decline. And then once it starts to decline, the body will start fatiguing, and you'll start noticing that whole fatigue that starts to set in. So what we want to do regardless in either of these two disorders is we want to support the adrenal glands, and we really want to find out and investigate what has caused this problem to begin with. What stressors or triggers have actually caused the adrenal glands to malfunction. Now, in typical conventional medicine, we look at adrenals being either due to a tumor, a pituitary tumor, or they've completely failed, such as an Addison's disease. But what we know now is that the adrenals can actually still not have a tumor or not have any of these type of failure, but it could malfunction. So what that means is that they could be tired, they could be stressed, it could be due to sugar imbalances, it could be due to a variety of different things that can stress the adrenal glands. Infections, toxins, chemical sensitivity, food sensitivity. So it's important that in this disorder, in both of these disorders, that the actual triggers are identified and at least addressed. So once these triggers are addressed, then proper treatment can be employed in order to actually start supporting the adrenal glands and supporting the body and supporting all of these different functions that the body needs, such as the brain and the nerves, and really start to reboot your body and reboot your system. We use in our clinic some testing. We use organic acids testing, which really identifies how the body is making specific compounds and energy and byproducts of cellular metabolism. Because what we find is that when the mitochondria in the cell dysfunctions, it causes issues with fatigue. So it's important that a slew of tests are customized and that are utilized for a person to really find out the underlying cause. So I hope this video gives you some more insight about chronic fatigue and fibromyalgia. I just want to mention is that a lot of times with chronic fatigue is that it is usually a virus that usually is common that we find with chronic fatigue, more so than any of these other type of factors. But all of these factors can play a role with this and can affect the adrenal glands. I just wanted to make that note to you. But yes, both of these disorders, each one needs to be addressed in its own self, and each person is different and each person's cause is different. So that's the beauty about functional medicine and functional testing, is that even though that there may not be actual disease or a tumor or some sort of complete failure or shutdown, at least we can find out what are the underlying dysfunctions in the body. So again, I hope that this information has helped you and has put things more into better perspective. And please, if you like this video, please don't forget to hit the like button and subscribe button, and don't forget to hit that notification bell. I want to thank you again for watching this video. I'm Dr. Tony Salamay, and have a great day.